If your mother or sister has ever had uterine fibroids, the bad news is your risk of developing the condition is 3 times higher than average. This is the most common condition in women aged 30 to 50, but can these tumors turn into cancer? And how does vitamin D deficiency affect them? The next 5 minutes will help you protect your uterus before it's too late. Today, let's explore a common issue among women: uterine fibroids. Uterine fibroids, also known as leiomyomas or myomas, are benign tumors, not cancer, formed from the overgrowth of smooth muscle cells in the uterine wall. They are most commonly found in women aged 30 to 50. The exact cause of uterine fibroids has not been clearly determined, but scientists have shown a link between fibroids and factors such as hormones and family history. Regarding hormonal factors, scientists have evidence proving that fibroid growth is related to a woman's hormones, estrogen and progesterone. If the levels of either of these hormones increase, the risk of developing fibroids rises. Therefore, we often see that women of reproductive age are more prone to developing them. Conversely, when reaching menopause, as hormone levels decrease, uterine fibroids tend to shrink. Regarding family factors, scientists have observed that for women whose mothers or sisters have fibroids, the likelihood of developing the condition is 3 times higher than that of the average woman. Additionally, there are several risk factors conducive to fibroid development, such as early onset of menstruation, obesity, an inappropriate diet, and finally, vitamin D deficiency. So, how do uterine fibroids affect health? Obstetricians and gynecologists consider uterine fibroids a benign condition if the tumor is small and causes no symptoms. Patients may simply detect fibroids through regular checkups. When the tumor size increases, a woman may be able to feel the mass in her abdomen, or these tumors may cause compression symptoms on organs within the abdominal cavity. For example, compression on the bladder will cause frequent urination. Compression on the ureter will cause hydronephrosis, kidney swelling, and dull pain in the lower back, lumbar region. Compression on the rectum causes constipation. Furthermore, when a fibroid is located near the uterine lining, it can cause menorrhagia, heavy menstrual bleeding, or metrorrhagia, bleeding between periods. If left untreated for a long time, it can affect a woman's health, causing issues such as anemia, dizziness, and reduced quality of life. Uterine fibroids usually have little effect on a woman's ability to conceive unless the fibroid is large or located near the endometrial cavity, distorting it and ultimately making it harder for the woman to get pregnant. However, this case only accounts for 5 to 10% of infertile women with uterine fibroids. During pregnancy, however, uterine fibroids often carry more complications. Possible complications include miscarriage, preterm birth, pain due to compression, necrosis, or infection. Additionally, they can cause abnormalities during labor and delivery, such as abnormal placental attachment, like placenta previa or placenta accreta, difficult labor, dystocia, and a risk of postpartum hemorrhage. So, can uterine fibroids lead to cancer? Uterine fibroids are typically benign tumors. However, they do have the potential for malignancy, especially tumors that grow rapidly or those that increase in size after menopause. Therefore, periodic monitoring of uterine fibroids is very important to detect early signs and provide timely treatment for any complications that may occur. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.